Yeah.
Good morning, everybody. It's now 10:36 a.m. in the morning, and keep in mind that in this group, please give your opinion and help. Let's help the crew out with this. Okay, let's go down on the agenda. And I would like to remind people that on this agenda, everything is real tight. So we please keep in mind on time when giving advice, opinions, and so forth. So, um, for the icebreaker, uh, if you could start your year anywhere in the world, where would it be? My name's George. I'm down in Medford, Jackson County, Southern Oregon, co-chair with Maria on this committee. And I would, let's see, I would go to, I would say Paris, France, like the Eiffel Tower. Would like to get to meet the people and see how they are, see if they're different than us over here, and maybe try out their foods, which I'm pretty sure that is different than ours. And I'll pass it on to Vanessa.
Howdy, Vanessa Broadley from the South Coast Regional Early Learning Hub, and I would say New Zealand.
Maria.
Good morning. Can you hear me okay? I couldn't hear a thing and my video keeps going off. I apologize. I kind of feel like I'm going to have some issues today. But anyways, Maria Park, Senior Program Manager at Asian Health and Service Center, co-chair here with George, and I would like to start the year right here where I am. I just wish it would snow though. Anyways, Happy New Year. Good to see you all. I will pass it to Dion.
Hey everyone, I'm Dion from with the state here in the Salem Kaiser area. Uh, for me, I would definitely head back to Kauai to start my year. Either that or head over to my namesake, Destin, Florida, the white sandy beaches. And then let's see, and I'll kick it over to NJ.
Hi everyone, Happy New Year. Inje with Asian Health and Service Center Community Program Coordinator. Um, I would like to start the year with my parents in Korea. I will pass it to Brandy.
Okay, good morning. Can everyone hear me okay?
Yes.
Okay, got my earbuds in for like the first time next to my computer. But if I could start the year anywhere in the world, I'm gonna say anywhere tropical and warm. It's fine with me. And what else? I'll pass it to Susan.
Susan Garcia with the Community Health Centers of Lynn County, and I think Santorini, Greece. That's a place I would like to go. Pass it to James.
Hello, everyone. Yeah, James Barda, him, community or engagement strategies coordinator with the state. And yeah, I was thinking Southern Hemisphere just to get the longer days. I'm happy that the days are slowly getting longer already. But so we've been talking about a trip to South Africa to visit a friend, so I'd like to do that. And I will pass to Christy.
Hi, Christy Reese. She, her pronouns. I am from Fact, Oregon, and I think tropical or maybe Spain. And I think Veronica, maybe? I'm not sure if I was it or.
Yep, I haven't gone yet. I would have to jump on the bandwagon of summer warm and tropical and or Europe. Who hasn't gone yet?
Andy Arthur hasn't.
Can you guys hear me?
Yep.
Okay, great. If I could start my new year anywhere in the world, it would probably be Ireland. That's where I would want to start my year off. Anyone else not gone?
Andrew.
Yeah, hey everybody, Andrew Denray, he, him, his. I am the business analyst for the ONE Online portal, and I'm gonna go with everyone who has said somewhere warm or tropical. Really anywhere will do, with nice weather and a nice beach.
And we have Rocco, ROCIO.
Oh, Rocio.
Yeah. He's next.
Rocio, introduce yourself to the group and throw out your icebreaker question answer. If you're able to come off mute.
Oh, good morning. My name is Rocio Alvarado. I'm with the APTT technical team at the moment. If I could start my year anywhere in the world, I would like to try Italy. That's somewhere I would always wanted to go. So on my bucket list maybe for this year, if not the new year, that would be great.
Cool. Okay, now we got everybody. Is there anybody that we didn't get? James, do we have everybody
I
here?
think we have everyone.
Okay. Andrew, go ahead and take over.
Yeah. So upcoming builds, request 77, clarify how to report a change about a household member leaving. So the first part of this went in back in October, and that was updating the page breaks and some of the labels on buttons on the screen. Part 2 is scheduled for our February build, and that's changing text options and add info text. So this actually, I should have updated when we were making this slide. This I think is actually being delayed. We're still working with policy areas on how to get this updated in a way that works for everybody. This second part of it's a little bit complex.
Okay. So we're not sure when it's going into the build then?
I think it's currently scheduled for April.
Okay.
Yeah. Request 80, update document upload guidance language in ONE Online portal. That is scheduled for February. And then request 81, creating a user-friendly password reset link sent in the email. So when you're requesting to reset your password, that is also scheduled for February 26th.
Cool. And yeah, so here we are back into the big old work items that we've been plugging away on. So I think it's time to move over to our briefing sheet. I was really annoying Veronica this morning with a lot of questions about it. So just give me a moment to bring it up. But Veronica, you want to start us off on it though?
Yep, so little recap of last month's meeting while James gets the briefing sheet up. There were a couple of different requests or action items that I took back. First one, a decision was made last month by you guys to not move that community partner text to the CP screen and leave it on the Let's Get Started page, but there was a request to break that up into dot points. So I have a mock-up to show you guys today of what that looks like. There were several different options of the what are you applying for screen. One big question you guys had last month is, can we add those links into help text? So I had to go and connect with Deloitte to see if that was functional, if they could actually do clickable links in the help text. And Deloitte said that we can. So I got a couple of screenshots to show that mock-up for you guys, along with several other, like there's like maybe 5 total different variations of that screen that you guys wanted to see. So that's kind of what I have for that for request 82. James, were you going to share the brief?
Oh, here I was scrolling through it thinking I was sharing. Well, sorry about that, but yeah, here's the page where with the potential links and how it might look.
So let's start at page from the top at page 10.
Did you make that bigger, please?
Okay, and we'll get to the top first. I mean, there's a lot of pages here.
Top as in page 10.
Okay,
so there's a lot of all of the screenshots that you guys saw last month. I left them in the brief. I wasn't sure if you guys wanted them for reference or not. All of the new screenshots, the new mocks are starting on 10, page 10. So first mock-up you guys are looking at here is that community partner paragraph that I broke into different dot points there. So gonna pause here for you guys to kind of digest that and vote on if you like that or not, or if you want any additional changes to that.
I'll add that on the previous page was an old mock-up of a separate web page, but since we've decided on this is the mock-up that you all want.
James, so I actually pulled up the design for that after you mentioned it. In that second paragraph there, are you currently receiving benefits? Apparently that displays dynamically based on whether the user is linked to a case or not. So it may or may not be there for the user.
Thank you. So this is literally that after they sign in, this is what people will see.
This is what they'll see when they click to start a new application.
Right. Okay. Thank you for bringing that up.
So Veronica, you have like 5 separate ones, and this is like the first one, right?
This is for the Let's Get Started page. This is the only additional change. So the only additional mock for this screen. The other mocks are for the other screen. So when they click next on this Let's Get Started page, they go to a screen where they select what programs they want to apply for. That's the screen that I have several different variations for.
Do you want to vote on this?
Yep, I think we're in a good spot. So last month we did a lot of other rework for this specific screen. So this little green box section is the last little piece we have to wrap up this screen here.
So guys, what do you think? Need your opinion. Hi, April.
This is Christy. I think this is very, it's just much more readable. So I like the addition of how it's broken out.
I like it also. I personally would like the find community partners in your area by visiting the links before that you can meet with them in person. Like, this is where you find them. Also, you can meet with them in person or over the phone.
Yep, that's a good
And then the call in one customer service. Otherwise, I think it's great.
Susan, Maria, Inja, Nessa, Brandy, what do you think?
I think it looks
Veronica.
good. And I like the moving those as well.
Maria?
Yeah, Veronica, trying to remember what it looked like before. I I remember there was just a lot more content and information about all those different programs, and then we kind of moved that and kind of cleaned this up into different sections. Is that right?
Yes, that's going to be on the next screen. For the CP paragraph itself, that previous mock-up is on page, let's see. There's a screenshot of it on page 6 in your brief.
Mm-hmm.
Sure.
And okay, and then so like I can kind of see, or I'm not sure if I'm seeing it correctly, but is all like the fonts and the colors, are they all different in each section?
They are, because it is a mock-up. I literally have a paint tool to work with. So this is not what it will look like in front of
Okay, I was like, okay, that's good. That was all. Thank you.
And we'll include the phone number too. Yeah. Did you want to see page 6 or were we good?
No, we're good.
Okay.
Susan, what do you think?
I'm just not sure what we're voting on this, or we're looking at more after this.
Yeah, we're voting on this. We're trying to see what you think.
Yeah, there's other parts we still have to look at and determine. This is just this one part.
I thought we were just doing links on a different page. I'm not clear what's happening.
We are, and they're gonna be on the following screen. So the next mock-ups that we'll look at.
Yeah, Maria, your thing in the comments,
original.
It's what I've discovered is the original actually has a few different things because it was an older page that changed the text around a little bit, and I got distracted by that when I was looking through it. So if we just if I go to page 6, you can see some of that old text though. Or I guess it's not that old, but this area right here was the old community partner text.
Okay, Brandy Arthur, what do you think?
I think it looks great.
Yeah, I think it looks better.
Okay, so let's vote on this. So are we all in agreement on this before we go on to the next one? See some thumbs or something? Okay, there's 1, 2, 3, 4, 5, 6. And I will have mine's up too, and there's another one. So we're all in agreement, Veronica.
Awesome. Moving on to the what are you applying for screen. So the first, that's going to be page 11.
Okay.
Yep. So the first screenshot there is with the caret drop down option. So I moved the text up to the top. The top screenshot there shows what it will look like with the caret open. And the screenshot right below that shows what it looks like if that section is closed.
My personal opinion, I like it this way because when you get onto the first one that we just would take us to this, right?
What was that, George?
So the first one we had would, if we go and tap into that one, then this would come up, right? And this, we would have a choice? Is that what that is?
Yeah, so the text here on the first screenshot, the top section, this is the big section that we moved from that Let's Get Started page. And the one mock-up I had for you guys last month, this section was just added to the bottom of that screen.
Okay.
So with this option here, that text was moved to the top, and this mock-up shows the caret drop-down option.
Okay, well, my question to you is, once this is set up like this, is it going to be easier for the consumer to go click really quick? So it won't take them like a slow time to kind of go through your guys' pages, right?
So yeah, when they land on that screen, they'll actually see that second screenshot here on this page. And if they want to learn more info, it's just one click for them on that caret option, and then they'll see all the links.
Okay.
Remember, this is just the first option we're showing. There's
Yep.
some more too.
Okay. So what do you guys think?
You want to see the next one?
Sure.
The next one is just the two sections flipped. So last month there, I just had one screenshot where the links were on the bottom and there was a request to move it to the top. So that was the only change here. If no questions, we can jump down to page 13. This screenshot shows the option if we incorporate the links into the option. So I adjusted the text in the top paragraph and then added the links between each program.
So we have three options to vote on, right?
Yeah, there's one more.
One more. And then the last option here is adding in help text, the little question marks. And if James scrolls down one more, if they click that little help text, this is what they'll see, and the links to each program would be inside that help text. And Deloitte did confirm that they can add clickable links to those help text boxes.
I think I like the one that had the circles and the name and then the link underneath it. It was like three pages above this. Not that one. That one. So they're squares.
Well, this is the box they check to apply for those programs.
And the other ones didn't have that, right?
Oh,
All
the
of
other
them
ones-
have the checkbox option. That part we didn't change.
Oh, I see. Okay. I see the big difference.
I agree with Vanessa.
Okay, so let's go to a vote, guys, on, or you have any questions for Veronica on this before we vote? You see no hands?
Those four options. There, you could also have the on the first option when we have it above, either just as text or in a caret. You can have it below too, I suppose, just to make things more complicated. But
Yeah, James, I would like to, well, for me personally, would like to try to have it easier for, not just for myself, but for other people, like users. That way they're not having to struggle or to say, well, this is taking too long.
May I see the last option screen one more time? I want to see what it says in the text.
Maria, Susan, could you explain what you mean?
So there's just a caret and you have to click on it and then there it comes down as far as the options. it's not very obvious when you look at the page that that's what you, I mean, would it be blue or is it gray?
I think it's initially gray and it turns blue once they click on it.
Yeah. It doesn't tell you to click on it, so I don't know. It's just not as obvious as a place to click to find out more.
So what option would you pick, Susan?
Either 3 or 4. I mean, 3 was my initial thought.
Here's 3.
Yeah.
Okay, no more questions?
So with the last option, we can add text saying, if you need more information, click the question mark.
We can, yeah.
So probably up here, I guess.
Okay,
I think I like last option if we can add the text.
okay. Who likes option number 1? If I can see thumbs up. Who likes option 1?
Yeah, I'll get back up. Sorry, I'm just back and forth on you all, but okay. Option 1.
Option 1, going. I see a response. Who like option 2? And I see no response. Okay, who likes option 3?
Got 2 votes in the chat already.
Okay. Option 4? Okay, there's one likes option 4. Nobody likes option 4? Okay, do we have another one? So we have 2 option 4s. There's 3 for option 4. Anybody else? Do we have an option 5?
No, option 5.
Okay. If you go down, James, go down.
Oh,
Keep going.
option 3, 4, option 3.
My option would be this one. Not sure what option that is.
That's 3.
Yeah, mine's option 3.
So we have a majority for 3, but we still we have 2 or 3 people are interested in 4. I think if maybe one of the 4 people wants to make the case for it.
Now's the time. Speak up. Anybody?
I like option 4 best, just because it's just simple, easy to see, but I think option 3 is good option as well.
Tracy says he would go rather neutral or option 3.
Is there any
I mean,
technical?
what I don't like about option 4 is it feels like one more thing they have to do. So they have to hover over the question mark, and it doesn't actually give them any information. it just gives them the link, right? So when I first saw the question mark before she hovered over it, or you showed that page, I was like, oh, it's going to actually have relevant information, but then it didn't have anything. It was just a link. So just felt like another step that people have to take, and they're already possibly stressed out. Filling this crazy application out.
Okay, bye, Susan.
Sorry, Susan.
So do we have everybody voted? Vanessa, did you vote? Did we have everybody vote already? Brandy Storm, Brandy Arthur?
It's George earlier in the chat. I think they voted.
Okay, Veronica, did you get what you were looking for?
It looks like majority voted option 3, which is the one James is displaying.
Okay, so are we done with this one?
I believe so.
Judy. Judy,
Yes, yes, George.
did you want to vote on this?
Well, I just now came on.
Okay, James, let Judy please look over this.
Well, we had it narrowed down to these two options. Which screen do you think
Oh,
makes more sense?
okay.
This one where the info text, this is where the page where people have to click on they're applying for, and then there's info text or links to infinite information. And then instead on this one, those same links are just put into the info pop-up boxes. And here's an example of one right here.
I like the other page better. I know that this is a simpler version and it's easier, but people are complicated and they think differently, and I like this one.
Well, I'm gratified to hear that because that's what the group had also come to the conclusion of.
Oh, yay!
Okay.
All right.
So we consider this one done.
Yay. This one was one of our tougher work items I think we have done in the entire 2+ years of this group. So thank you to Veronica, as some of you already pointed out, for spelling all these out, and thank you to all for considering these. So take a breath, and then Andrew can walk us through request 88.
Yep. So 88, we did talk about, we kind of went over all of it last time. We didn't get to a point of making any decisions because we had a speaker join us. So I'll kind of give like an overview and get us back to where we were before. So there's multiple points within the application where we have existing wording around medical expenses, and on the expense screen is where we ask about medical expenses. But the goal here is trying to make it more clear and easier to understand what are allowable types of expenses, what aren't allowable types of expenses, common types of proof that someone might be able to submit, and who should be submitting that information. So this list of possible suggestions was kind of the first thing we presented, I think, 2 meetings ago. But then if we scroll down, I think starting on the next page, we'll have some more, well, maybe 2 pages down. Keep going a little bit. Here we go. So these are more specific examples of what exactly we're proposing and where exactly we're proposing to update this information. So currently on this screen, there is, there's the option to upload documents, but there isn't a blurb about medical costs. So we've we're proposing to add a dot point to this list here, saying that proof of any medical cost you have reported on this application, such as receipts for medications and supplies, documentation from pharmacies, or notes/other contact from a medical provider. Proof should include the cost, frequency, and show that use is under the direction of a licensed medical professional. So that, on this page, they've already gone through the screens and pretty much the whole application, but they would have already reached the expense screen where they would have reported this information if they had it. So the idea here is it's a little bit more succinct and not explaining exactly in detail everything that they might want to report, but more of a reminder to what kind of document they would want to upload here on this screen to support something that they had reported previously. And yeah, we can continue to the next page.
Any questions so far?
And then this again is a screen that comes later in the application. It's called the next steps screen. So this is after the application's already been submitted. And the section that I've proposed to add this here doesn't currently say anything about medical expenses, but it tells a number of other a list of other things that we would need. Common information that we would need. So Social Security, citizenship, resources that have been reported, things like that. And so what we're proposing to add here again is a list of what some allowable costs are and what should be submitted for that. So medical and dental care, health insurance premium, deductibles or co-insurance. And something I want to call out here is last time I think George and maybe some others had mentioned that calling it co-insurance isn't super clear. So we would propose to update that to copay. So it would say medical and dental care, health insurance premiums, deductibles, and copay. Prescription drugs and prescribed over-the-counter medication, dentures, hearing aids, prescribed eyeglasses, and allowable costs associated with assistance animals, costs for transportation needs to obtain medical treatment or services, nursing care, and in-home attendance. Proof of medical costs can include, but it's not limited to, receipts for medications and supplies, documentation from pharmacies, or notes/other contact from a medical provider. Proof should include the cost, frequency, and show that use is under the direction of a licensed medical professional.
Sounds like it's all there.
Yeah, so again, at this point in the application, it'd be more just kind of a reminder again, if this is something that you had reported previously on the application, make sure that you're providing us this information so that we're able to get you those, the deduction for your expenses that you've reported.
But James, how would they get receipts for transportation? I'm not thinking about taxis and bus services. I'm thinking about their own car. How do they get receipts for that to add on to here?
As in reimbursements.
Okay. So you don't have to have a receipt for it.
No, that's just I guess like the proof is kind of like a general statement of like what it could be, but really it really can be anything that proves that you had to use transportation to obtain medical treatment.
Okay.
Andrew, does it anything on there when you put that in there? Does it tell the consumer why you guys need that? Is there a reason? I mean, is there some people are a little leery about doing that unless they really know what the real reason's for.
Yeah, so as we on the screen that we ask about medical expenses, it does explain, I think, kind of why you would submit. I don't have the exact wording in front of me, but I think if you scroll to the next screen, we might be able to see it.
Okay, and what you put down, it's not repeated anywhere else, right? Just at one location?
Well, it's repeated on it's on the document. We're proposing on the document upload screen, and then also on that next step screen, and then also on the actual screen that you're reporting the expenses. So it'll be in 3 different places, in different variations of it. Just because we're trying not to, we try to always keep in mind that there's already a ton of information on the application. So like trying to provide as much info as we can without making the application more overwhelming.
Okay.
Maria asks, wouldn't we need to include both co-pays and co-insurance? If that makes sense, we can do that. I'm kind of an insurance idiot. I don't really know anything about insurance. It's something I just like kind of don't know a ton about. So is there a difference between a copay and co-insurance?
Oh yeah. Oh yeah.
Okay. Okay. So should we list both?
Only if it's explained what co-insurance is.
If it's just examples of allowable medical costs and it may not be including all of those in that section, then it's fine. I guess we wouldn't need to include it, but yeah.
Mm-hmm.
Yeah, I think it's supposed to be capturing as much as we can. It's medical costs could include, so like I think either could be qualified for it, but I don't think the list is supposed to be exhaustive. Like just because it doesn't appear on this list doesn't mean that we can't consider it.
Right, okay.
I agree.
Is there anybody would like to ask Andrew a question about this? Please voice your opinion.
Andrew, may we go back up to that section that's being updated? Is that what we're looking at?
We're looking at that for this screen. There's a previous screen we looked at, and then there's an additional screen that we'll look at as well.
Okay. So here's the first one, document upload.
And this is more specific to, like, this isn't listing out all the different potential options, because at this point we're assuming that you've already reported to us what you're trying to report, and this is more specific to like a reminder to upload proof of any costs that you have reported.
Okay, I'm going to go to the next one.
And then this is it's kind of just a general reminder of like what we'll need as we proceed through the interview and application processing, to make sure that we're able to accurately process the application and account for all the medical expenses that someone's or other expenses or anything really that someone's reported on their application. So yeah, and we had a little bit more space on this page, so it's a little bit more expanded than was on the document upload screen. And then if we scroll down, there should be more screenshots below the next page, I think.
Yeah.
And all that text, the text is just like written out.
What appears in these new things.
Yeah, exactly. And so then this is what would appear on the help text. This is what would appear on the help text for the medical expenses field, and it does obscure the medical expenses. So give me just a second. I can tell you what it actually says on the expense screen for medical expenses.
Do we have large that?
Yeah. It keeps flipping up on me, sorry. But, and keep in mind, we can, if you want to read that text, I can go back to the previous page that has this text on it.
So are we asked to decide one or the other, or just to vote on one?
No, so all 3 of these would be we're proposing to update all three of these options. They occur on different screens. So there's not different options you're being presented, but more just like, does the content here, do we feel like we're getting to the goal of making it more clear what should be reported, or what can be reported, what can't be reported, and then what you would need to provide to verify that information. So I can kind of walk through this one here. The first of all, on the what's kind of obscured behind here, the actual question, medical expenses, it says, does any elderly, blind, disabled, or refugee individual in your household have medical expenses? Elderly means at least 60 years old for SNAP and 65 years old for medical. And so that's all the question asks, but then there's the help text that appears there, and we're proposing to put all of this information in the help text. So, and it starts off by explaining why we're asking that. And I think, George, that's kind of what you were getting to, why we're asking for all this information. So telling the department about your medical expenses may increase your food benefits or reduce the amount you pay for long-term care services. You do not have to tell us about your medical expenses, but if you do not report these costs or verify these costs when asked, they will not be used to figure out your benefits. So that's, in general, why we ask for that information, is to either increase the SNAP benefits or reduce long-term care costs. And it's, yeah, what's up?
Now, Andrew, when you say 60 and 65 years old, I don't see that in here where a person can see that.
Yeah, that's why I was explaining. It's in this. So in this screenshot, you can see there's the question medical expenses and the text is obscured. That's where it says it on the screen. And this thing that's blocking it only pops up when you click that blue question mark.
Oh. Okay.
Maria?
I think I mentioned it before, Andrew, like, is it okay if we include something about vision and dental in that question, or maybe say something like medically related or something?
In the medical expenses question?
Mm-hmm. Because they are able to include dental and vision expenses, right? But and then it seems like a lot of other things too, but yeah.
Yeah, I would yeah, so they are, because the allowable costs include like things like dentures, hearing aids, prescribed eyeglasses. So that would include those would be included in medical expenses. So you're saying, rather than just say, does an individual in your household have medical expenses, we would want to say, does an individual in your household have medical, dental, or vision expenses?
Mm-hmm. Or like, I don't know, it's a better way to medically related, no, medical related expenses or medical, dental, vision expenses. I think that gets missed a lot. So that's why I'm wondering if there's a way that we could incorporate that.
So this would be in the help text. Just, this portion.
Right, but I was just wondering if in the question itself.
Oh, right.
Yeah. I'm trying to type something up real quick as like a proposal.
This is a reminder. This is the text.
Andrew, something just came across when it says or reads credit card debt. some people may think, I just got to thinking, some people may think that you guys might want their credit score. Is there any way to word the credit card debt, medical expenses without having people think that you guys are checking on their credit score?
Yeah, I mean, we can talk about that for sure. So that was something that was brought up last time when we talked about this as well. Is that the way I'm not looking at it now, but the way I have it proposed in the screenshot below is slightly different than here. And I think the concern before was like it sounded like you couldn't claim medical expenses that have been paid on a credit card. So I think it's a little bit different than what you're saying now, but in general, that's kind of on my mind is rewording the credit card debt question or the costs are not allowed to make it make sense. And I guess, as you pointed out, to not indicate that we're looking into people's credit history.
I would think if you put it in parentheses, you put in parentheses, not looking at credit score would probably help after a credit card deal. I didn't catch it real quick. What was
these are all things not allowed anyway.
Yeah, so I don't think we're saying like it's not like we're looking into all of this stuff. We're already saying, as James mentioned, that like these are things that you cannot claim on as an expense. And to clarify, like the credit card debt related to past medical expenses, the expense must be for an allowable medical cost that is current or ongoing. It doesn't mean that like, I've got a prescription every month that I pick up that I pay on my credit card. Like that would be an allowable cost because we're looking at the cost of the actual prescription that's ongoing. But if you're like, I had surgery last year and I put $10,000 on my credit card and I'm paying that off $50 a month, that would not be an allowable medical expense because it's not like the actual medical service is not like an ongoing thing that you're getting. I don't know if I hope that example made sense.
I understand that, but some people understand certain things and some people do things differently than other people.
Mm-hmm.
And I just wanted to thought that it might be clear if you would, put it in parentheses, not looking at credit score. Because some people will look at this and like, oh my God, are they going to look at my credit score? Credit cards do go on credit scores. If
Absolutely.
you go to Equifax and TransUnion.
But this is for expenses, though. We're not looking at people's resources or.
I know.
Yeah.
I know. I know from you guys' view, but, like I said, people think differently than other people.
Dion, I like that. I mean, I think it's credit card expenses rather than debt.
Mm-hmm. And right there, it raises
a good way to help it.
A question, yeah. Well, why would they be checking in my credit card, on my credit card score? Some people would perceive that.
George, I think because it's saying that we're not going to be accepting those would not, those costs are not allowed. They wouldn't be taking that information. So hopefully that'll be clear.
I don't know.
Andrew's got a new thing in the chat.
Andrew, I like that one even better. Sorry, Dion. I like Andrew's better.
Okay, I have a proposal. We're at break time. Why don't we, think about this and consider Andrew's proposal, and we can come back at 11:41 and finish this up.
I'm sure glad you keeping track of it because I don't have the agenda in front of me.
Okay, and Dion, if you can pause and come back to the decisions we need to make on this request that Andrew has been laying out for us. Basically, Andrew, you came up with a lot of the text, and we're just making sure that it's that covers the problem that needs to be addressed. So,
well, like I was saying, you can have it that way. It's just some people will just think it's like checking into their credit report.
yeah, so I'm just, for my own mental health, reviewing what we have. I guess, here are the suggestions for allowable and unallowable, and the little text that would go on the document upload, then the next steps page, a little more detail, and finally, which was outlined on that first page, and then finally all the stuff that pops up in that information button, the pop-up button.
So James, this is Christy. As we were going to break, I heard some of the comments, but I would agree with having fewer words. And I think what Andrew put in the chat, I thought sounded great. Credit card expenses related to past medical costs. For me, I don't equate that. And I think if someone does, they would ask a question. But I think this is rather a customary, like, you're not signing anything for credit and whatnot. So I would support the change in language. I appreciate the perspective, George, and I just am not sure. I don't feel like we need to add more language to that.
Okay. So are we up for a vote?
Well, I want to make sure we know what we're voting on, I guess. Is everyone okay with the previous 2 pages?
Yes, I am.
I guess I have one question still is we had a brief conversation about copay versus coinsurance, or if we should include both. I don't think it's a problem to have one extra word. So if we think it makes sense and it's more inclusive of potential costs, we could say deductibles, copays, and coinsurance if folks feel good about that.
I don't have a problem with that. What about you, Brandy, Arthur, Vixen, Vanessa, Maria?
No problem.
I'm good with that.
I am too.
Sounds good.
Vanessa is too. And is there anybody we're missing? Christy? April?
Sounds good.
Okay, well, you got your answer.
Cool. So yeah, then any remaining questions about this help text that we're scrolling to here?
Do you want to see the screen, or do you want to see the text?
Guys? Inja?
Is it about the credit card expense?
Thank you. Thank you.
Just
Yeah, that looks good. Thank you.
or just any of or just any, I guess, before we vote on if we want to move forward with the changes we've talked about, any other questions about any of this help text that's been proposed?
Randy, Vixen,
What is notes or prescriptions? Now I understand prescriptions, but what are notes?
It could just be like a handwritten doctor's note that isn't like the actual prescription, but just something from the medical provider. It's something that's a lot of this comes from our like policy guidebook that we call it the open. And that was listed in there, so that's why I included it here.
Okay. So it'd be like somebody who needs a pair of orthopedic shoes or a pair of maybe a walker or something like that, and he would just write a note saying this is what you need, and we would allow that.
Yeah, or just like someone lost their prescription or something and they go to see their doctor, and rather than getting a new prescription, the doctor writes a handwritten note saying like, yes, I have prescribed this person this, which costs this, which yeah, basically any note from the doctor that could confirm the cost that they're describing.
That's covering everything.
so Christy, April, Brandy, Maria, Vanessa, Judith, and Jen, are you okay with this?
I'm okay.
Yes.
I'm okay.
Okay, it's 3, it's 4, 5. Christy? 6. Then 7. Vanessa, what about you?
Looks good.
Okay, there's your vote, Andrew.
Cool. This is the
oh, go ahead.
I was going to say this will be the same text. We're just showing that the help text comes up on both the Gatepost screen and the summary screen, but the text would be the same on those question marks.
So are we okay with this, guys? Okay, it's 1. I'm 2. April? Brandy? It's 3. It's 4. Brandy, Maria, Vanessa, yep. Judith? That's 5.
Yes.
6. Maria? Okay, Anja? Okay, Vixen, did you vote?
Yep, I give a thumbs up.
Okay, you got your vote, Andrew.
Cool. Sounds good. We'll get it in.
Ooh. Nicely done, Andrew. Thank you. Thank everyone for figuring all this out. So we have a couple other requests that are on our docket, and then we can take a look at our charter and wrap things up. I made a pitch that the co-chairs agreed with. That I'm going to skip 89 just really quickly because 95 is pretty straightforward. So we can get a decision from this group. I think I'm going to jinx myself here relatively easily. So I don't know, Andrew or Veronica, when do you want to talk about this? Because you're probably better at it than I am.
Yeah, I can grab it. I'm pretty sure I entered this one in. So as James said, this one is pretty simple. There is no changes that we need to make to the system or screens or anything like that with this request. So right now, when a user does not log into their ONE Online account for 395 days or more, the system automatically disables their account due to inactivity. the current process to re-enable their account, the user needs to call the AP Tech team for them to basically unlock it. And the request here is proposing a system change that will automatically re-enable the accounts that were disabled specifically for inactivity after the user performs a password reset. It's important to know that this is only going to apply to accounts that were specifically disabled due to inactivity. Accounts that were disabled for any other reasons, like duplicate accounts, security issues, basically any administrative disabled accounts will not be affected by this. So the user would still need to call the AP Tech team for help with that. So with this change, that will reduce the need for users to contact the AP Tech team, allowing them to get into their account faster. And then it also decreases the volume for the APTT team, resulting in shorter hold times for users that are calling for other technical support. Okay, so to briefly recap, this request is proposing to have the system automatically re-enable accounts that were disabled due to inactivity after the user resets the password on their end, on their own. Pausing for questions, clarifications.
I have one.
I was just going to say that AP Tech team, that applicant portal technical team, that's like, for instance, where Rocio works. So they get these calls and having to walk people through to reactivate their account.
Veronica, this is not going to mess up their food stamps, medical, or state assistance, right?
This does not touch their case or their benefits. It's specific to their online account.
Does it state it on here? That it won't mess up their services?
It's not stated, it's completely unrelated.
Well, from my point of view as a consumer, with this, it would be a shock to consumers not knowing if it will be messing up their case or not. So I would suggest, as me, is to put on there also that it will not mess up their services. Because a lot of people are going to look at this because they're going to freak out.
Well, George, nobody's going to read this. This is just the request. This is just explaining the request, which is when you reset your password, your account will be re-enabled. So they won't actually read any of these words.
Oh, so nobody's going to read this.
These words are just for us to understand what the request is.
Okay.
Yeah, nobody's going to read this. My question is, especially because I look people up in the ONE system, I see a lot of duplicate accounts. And so I'm looking in there to verify ERDC status, and I can figure out who I'm looking at, but I don't know which account to click on. I end up clicking through sometimes 3 or 4 different case numbers. And so from our end as like helpers, how do these inactive accounts ever go away, or the duplicate accounts ever go away? Because
so 2 different things here. What you're seeing when you log in is duplicate cases.
Mm-hmm.
This is specific to duplicate online accounts. So duplicate applicant portal accounts. That's not information that anybody can see aside from the applicant portal technical team. So you don't actually see the duplicate accounts there. Duplicate cases, they don't go away. They have to stay there for history reference purposes in our system.
Okay. So with the duplicate account, I mean, are the accounts mainly tied to their social security number or their email address?
Their email address and their social, if they chose to put their social in during account creation.
I can see April's point, because here lately the feds has been investigating departments with duplicates, and they have found one person that had 5 accounts in 5 different states?
I mean, all in all, I like it, I guess. I mean, I have one email that I use now, right? And that is the email I've used for 15 years. So if that was the one that I tried to log into, then I think it would be nice to re-enable it when I reset the password, if that's what we're deciding.
Yeah, so this change will not touch accounts that were disabled by a worker because they were a duplicate account. So basically right now, if I have an account and I don't log into it for 395 days or more, my account is going to get disabled. If I decide I want to log in, apply for benefits, I won't be able to access my account until I call the AP Tech team. They unlock the account for me, I reset my password, etc. This change is proposing to take away that call piece for me as the customer and to allow for that account to automatically be enabled as soon as I reset my password. So
Yeah,
it
I think
basically
that's a
just
good
saves a
idea.
phone call for the customer.
Yeah, I think the less time the customers can spend on the phone with the government is better.
What exactly is the customer seeing when they receive this error of no account or something? Because I think that can also lead to a lot of confusion. So is there an image of what someone will see when the
Yeah, I can find something. They get an error saying that their account was disabled and they need to call the tech team.
And you put disabled due to inactivity?
I am pulling up the errors right now so I can paste a screenshot in the chat.
You may have to share your screen or email to me, one or the other.
Yeah, I am pulling it up.
And it does say disabled due to inactivity.
Good, good.
Cool. Thanks for sharing.
Do they receive notice that says their one account has been disabled? April is asking.
Did they receive a notice? No, they don't.
I mean, if someone hasn't logged into their account for more than a year, that likely they just let their benefits expire too, or they just don't use their one system. I guess you can do everything by the phone. So,
Well, I think it would be a great option if they did receive a notice. Then that way they were aware that it's been disabled.
It's not letting me send a screenshot in chat. So James, can I steal your screen share?
yeah.
Some people may not know that it's been disabled.
Ooh,
baby.
Very cute baby.
Oh,
He's 5 now. I just love that picture. Okay, so this is what the error looks like. It says this account has been temporarily locked. Please contact us, phone number. This example here says try again after 1 hour, but if they are disabled, they won't have that option.
so it doesn't say due to inactivity, it just says it's been locked.
There is okay, so here's the other example. The account has been disabled. Please call us with the phone number.
Oh, so that first one isn't necessarily what the person who's expired sees. It could be a different message.
Yeah, this one is a little different scenario. It's when they're locked out.
Yeah.
Veronica, I want to ask a question, and with this being presented, does the tech check emails before they reenact the account again?
Do they check the email?
Yeah, do they check the emails to see if the person has not done more than one account?
It is part of their AP technical team's process to check every callers for duplicate account.
Okay.
Yeah. So the decision that needs to be made on this one is, do we want to go ahead and allow for the system to automatically re-enable after password resets, or do we want them to continue having to call the AP tech team for help?
What does the AP tech team think about it? I imagine getting too many phone calls would be just additional work.
I know Rusia's on the call, so she can speak to this, but I also am like 99% sure that this request was submitted by the AP tech team, so
Yeah.
they want this.
Yeah.
Yes, we do want this. Just like Veronica explained, it saves individuals from needing to call in and sitting on wait sometimes.
Yeah.
So if it's just a unlocking or re-enabling their account, it does help them in the sense of saving themselves from needing to call just to unlock their account.
Yes, just saving time so they can serve other customers.
Right, that do have other errors that they run into. So versus this, we just unlock their account and then they can they save their time from needing. Yeah.
No, I would just go to preset account. Like if I, for instance, if I was to forget my user and password, I would want to reset it to put a new password in it. It would be easier for me.
Yeah.
Someone else going to say something?
Oh yeah, it was me. So once we make the change, either say it will not say contact the one customer service, either just say please reset your password.
Yeah, so I'm actually thinking through there right now. I think we would need to add a new error message that says to reset the password, because we still have scenarios like duplicate accounts or accounts that were locked by the staff for security reasons. Those the user would not be able, or the system would not automatically re-enable the accounts. So this message would still apply to those accounts.
So the system will automatically know and give the option to the consumer. Like if the account has been disabled due to inactivity, either say, please reset your password. But if it's due to other reason, then either say, please contact the customer service.
Yep.
Okay,
That's where my thought
great.
process is going. Yeah.
Yes, thank you. That's great.
And Veronica, I think I would also, with the feds doing investigations on states, this would try to also maybe protect your guys' department if an audit was to be done. You see where I'm going with this?
I'm not connecting the dots. I'm not sure which investigations you're referring to or how they would like tie into.
Well, like money waste and so on and so forth that they're doing. They're doing it in Minnesota, Ohio, Maine.
Yeah, they're investigating like case benefits though. Online accounts are separate from benefits themselves, and I'm not sure that password resets would affect that at all.
What was that message that came up in purple?
Oh, because Veronica is showing her entire screen as opposed to just a window, so any IMs will pop up before her as well.
Oh, okay.
Any instant messages, that is.
So Veronica, you want to vote on this?
Yeah, if you guys are ready.
All right. Vixen, Brandy, Vanessa, Maria, how do you feel about this? Vanessa? Thumbs up. There's 1, 2, 3, 4, 5, 6, 7, 8. And my vote?
And mine.
Yep, I counted yours too.
Okay.
Okay, Veronica, you got your vote.
Awesome. Thank you guys.
Oh, and the error message pretty simple, so I guess we won't have to worry about it. All right. Well, that is impressive. We wrapped up 3 different work items today, which might be a record. And I'm going to just take a couple minutes to, if I can bring up the right screen here.
Yay, the charter.
Yes, the charter. Dun dun dun.
James, are we done with that one? Is it 88 or 89? Or was it 90 that
95.
We skipped?
We skipped one.
Okay.
I can talk, we can talk about that in the wrap up. But I just wanted to plug that the first months of this group, and more than 2 years ago, we one of our tasks was to create a charter, and so we did, and it worked pretty well. But when I look back on it now, it's obvious that we had certain certain goals, certain ambitions to do things that we're just not doing, such as we would have subject matter experts. Oh, well, join only is needed. And I guess, given the expertise of Andrew and Veronica, we haven't really needed to do that. And, as just as for instance, so we have elections, which we haven't done since the beginning, which we said would be yearly, for instance. And so just a lot of little things. So I'm just taking this time to walk through this a little bit. We're not going to be doing a bunch of work right now, but I'm just sort of previewing it so we can spend hopefully more time in the coming meetings to discuss what needs to be updated, because this is, as I pointed out in the email to you, this is available publicly. Anyone who is savvy enough to navigate our websites can find this charter and take a look at it. So we want to have it actually reflect our work. And yeah. And so that is one of the tasks that we will face as a group. Any questions? Because that's really all I had right now. just asking you to, you know, take a few minutes to look through these. And I did write a few questions. Like we have two different ways of voting on things. One time we talk about of official membership, another time we talk about those present. So things like that. But any questions? Okay. That's great. Then I'm gonna stop sharing this. You all have a PDF copy. If you want a Word copy, let me know. Maybe that'll be easier to write your notes or whatever. That's yeah. Just say you're interested in that and we can do that as well.
James,
Yeah.
did you send me a mailed copy?
A paper copy?
Yes.
Okay. I don't think I have your actual physical address, George, but I will get that after the meeting.
Okay. Yeah, I think it would be better for me to go over it on paper copy. I can read it. I can read a PDF too, but as you all know, I've got a lot of committees I'm on, and I have to make sure I keep the ball rolling for my side.
That makes sense. All right. So, and if anyone else has any requests along those lines, just let me know. All right. So we're actually toward the end of our meeting. I want to point out that we did, like I said, finish 3 different work items. 82, the updating where the information the programs are on the Let's Get Started page and moving it over to where the people actually select the programs, updated the medical expenses, and just finished that system change that allows people to not have to call to reactivate their dormant accounts. But coming months, in addition to talking about the charter, we'll have our sponsor and all our bosses, Jillian Johnson, come back. So think about questions that you might want to ask her. It looks like she'll be able to come in February. And I was sort of talking away there just to give you a little bit of time to think about something the co-chairs were interested is let's have some thoughts of how this year went this past year in this committee. You don't have to talk about everything else. So George, Maria, this is something we had discussed before. Did you have any thoughts on of our successes and other work in this committee?
Yeah, I guess I'll start first. The reflection I got for this committee was that I'm happy that we are all together working as a team on many factors. We have accomplished a lot, I feel, to better things, to make it more readable, to make it more understandable, to make it understandable, not just for myself, but for others. I think that with listening to other people outside the committee saying some of it's really hard, so on and so forth, I'm glad that we've made it, at least try to make it easy. I consider you all my friends, and I'm glad we're working as a team. And I'm sure that we will work on bigger and better stuff here in 2026. Make it better. So I'm going to call on Christy.
Thank you. I think that I joined this group rather late, so I don't know that I can really speak to the year in review, but appreciate the opportunity to share perspectives. Thank you. I'll let you call on whoever's next.
Okay, Vixen.
Sorry, coming off mute. I agree. I like that we all work together and that we have a common focus. And I feel like we really care about the greater good of the program and our community members.
April?
Yeah, and just to echo what everyone else has said, I'm pretty deep into my childcare bubble. So it's been really nice to hear the other perspectives of folks who are working within the same system, but supporting our communities with the different programs.
And Vanessa?
Yeah, totally agree with April. Sometimes we just get really sucked into our one line of work, so it's been awesome to kind of just see the all the sides.
Juliet or Judy?
Well, I would say thank you to all of you because we all work together very well. There's never been any push or pull, and you can't say that about a lot of committees. And also, it is really nice to work with people like yourselves who are professional and are coming from the area that we're talking about, and you have dedicated yourselves to come here and do this month after month, and I just appreciate that so much. And I really do feel like the work that we have done is exceptional and it needs to be done, and we've stuck with it. Thank you.
Maria?
There's been so many wonderful reflections that everyone shared. So thank you. I really appreciate this committee's dedication and like our perseverance and respectfulness towards each other, and just truly appreciate like all the care and concern for our community members throughout the state, like hoping to work together and improve the one. And I also want to appreciate, kind of shout out to James and Veronica and Andrew and Dion for all your support through this too. Thank you.
Anja?
I truly appreciate the opportunity to be part of this group. Sometimes, English is not my first language. So a lot of times when I look at the system, I'm wondering if I'm understanding it correctly. I appreciate all of your patience with me, but I'm also glad that I can kind of bring that, the side of, that side to this group. So thank you.
Brandy Other?
I came a little bit late to this group. I came in, I think, at September, and so I just appreciate the collaboration with everybody. And I was newer to the agency when I came in, so I've been learning through osmosis through you guys, which has been fantastic.
Dion?
Yeah, I think the thing that really I really appreciate is just, we all understand how complex the system is, and just all the ways that we've found to be able to take suggestions and incorporate that into a more simplistic, user-friendly um, or user-friendlier type of system for people who are in a situation or have something going on that require them to have to come here to ask, to get help and seek help, and um, just finding ways to make it so the system isn't as much of a barrier for that.
And Andrew?
Yeah, just same thing a lot of folks have said about collaboration. It'd be really hard to do my job, which is to focus on updates to the online portal. It'd be hard to do my job successfully in a way that works for the public and people who use the system, people who help people use the system, without the input that we get from this group. I mean, I could go out and make all the decisions for the website from what I think is best, but being able to have this group to bring things to talk about options with really gives a perspective that that is important to have in making this system accessible and usable for everybody who needs to use it.
Veronica?
I also joined kind of mid-year or rejoined. I used to attend a few years ago as an AP lead and came back as a business analyst this year. So that's exciting. I appreciate everybody's different perspective, and I appreciate that you guys aren't afraid to speak up and say your opinion when you disagree or when you experience something differently in your work field. It's been awesome to kind of see all of the different work items we've done, some of them big, some of them smaller. Also change request, the self-scheduling one and the RDP one. I appreciate you guys volunteering to step in and help us with those, joining our jabs. I know that's an additional workload for you guys. So yeah, just appreciate everybody who is in this committee.
Rokio?
Oh yeah. My name is Rocio, and then I'm glad that, well, this is my first meeting, but I look forward to hearing everybody's perspective from different consumers. Glad that we can get this team together to get some collective information. It's been great to see a point of views that everybody brings. So thank you.
And James.
Well, this has been an amazing journey in this past year. I think we really got rolling. I cannot thank my fellow state staff people enough that make this possible, but I'm just amazed that all of you are willing to put in the time on complex things that frankly you're not paid to do, and that's a shame. But yeah, I'm just so impressed of the work and time put into it, and help us make a system that is better for everyone who uses it. So, and I didn't know what to think about this little exercise, but I'm very touched and happy to hear all of you.
And April, did we get to you already? Okay. And to top it off, as co-chair, I'm very happy to first have Vanessa as my first co-chair. And I'm even happier to have Maria as my co-chair now.
Yay.
I feel that we work really as a team.
Yes, thank you, George.
So
oh yeah, go ahead, George.
So is there is Julian already scheduled to come in here soon?
I could speak to that. Jillian, I did mention to her, so we are good for February for her to come. So if we have an idea of certain questions or topics that we'd like to hear from her about, I can gather those. You can email James and or I, and that way we can compile that. So if there's anything that has questions or specific answers you're looking for, that way she has time to kind of look those up if she needs to. But really, this is an opportunity to get back to our quarterly check-ins with her, and for all of you to ask questions or give considerations, things like that. But she is confirmed for Friday or for February.
Good. And has anybody talked to the Keisha's team yet?
I have not followed up with her, but I will do that this afternoon.
Okay. Would anybody like to summarize actions and decisions?
Well, I like to think I did a little bit of that. I mean, without going into the details of each of the work item decisions that we made, um, but like I said, we got it. Wasn't just today, but we wrapped up a lot of work that we've been wrestling with over the past few months, and so next time around, the we'll be with our deputy director, Jillian, and we'll be talking about the charter. And there's more work items. There's another one on the briefing sheet that we skipped over. I forget the number right now, but and we also have a couple other work items, maybe 3 more that are waiting in the wings that I will just lean on Andrew and Veronica to do the excellent work of preparing those sheets for you all. So, but that's it.
Yeah, we have, if I remember right, we've got 100 and a 101, I guess.
A lot of those are duplicates or submissions that don't apply to us and apply to workers. So, but if you look at the very end of the briefing sheet, those last few pages, I've been trying to keep updated all the different work items that we as a group have completed. And so you can see the entire list there.
Okay, I would like to remind people that to please get with people that agree or disagree with other things they would like to see in the ONE system. Please relate that to James and his crew. The more the work that we can do, the better we can better the system. Do you know if the security has gotten better on the ONE system? Does anybody know? We had talked about it some time back.
Sounds like a whole other topic, but I don't think we have ever had a security break in the ONE system here. But again, knock on wood.
Yeah, I was just asking if you're someone on your crew has worked on because I remember us talking about the security of it at one time.
Well, George, I know they just updated firewalls this weekend in the ONE system. So I guess to answer your question, yes, there has been recent work.
Okay, and James has put up a reminder, submit to the committee, and he's got the website.
All right, but I should point out we're at time, so probably should wrap things up.
Okay, before we go, James, I have noticed that I've been getting duplicate papers in the mail on medical and food stamps. Are we going to be wanting to go and work on those too, on the paper side of things? Or are we just going to leave them go?
Well, obviously we don't want to be doing that. Maybe what's going on in your case is something that we can talk about offline and see what might be going on. Because no one should be receiving duplicates of the same information.
Okay, well, with that being said, I will see everybody in February. And Maria, I will see you sometime the first week of February, I think.
Yes. Can't wait. Okay, Happy New Year. Thank you.
Happy New Year's, guys, and I'll see you